Hello everyone. I'll be presenting to you the management information system that I designed for the Ministry of Health in the Republic of Marshall Islands. My name is Fernando Lee, and this is my project for the CMSC 09. So basically, my presentation will cover the introduction, the background, the SWOT analysis, current system or the review of the current system, the project identification, the conceptual design, and of course the user interface and the implementation plan, and the last I'll be citing up the references for this project. So, introduction. The Ministry of Health or the MOH office is located in Majuro, the main capital of Marshall Islands. Marshall Islands is a country. It is the RMI government ministry that will handle all the health-related services. The RMI is constitutionally in free association with the United States of America, in which they can ask assistance by applying for grants. So currently, the MOH have already implemented several information systems across different clinics and 2 hospitals. There are several registration systems used to register patients having major diseases such as diabetes, TB, and other viral diseases. The challenge is that all of these systems are not integrated and that the data are not properly collected. So basically, these are silos system. Okay, geographically, the Marshall Island is located in the North Pacific Ocean, which is part of the Oceania geographic region. It consists of 29 atolls and 5 major islands, namely Kwajalein, Majuro, the Rongelap, Bikini, and Iniwitak. If you look at it, it's in between the Guam and Hawaii, and also there's a federated states of Micronesia. Then the next one is the Marshall Island. So the people. So there's pictures that I get from Miss Edlin Ansores. She's the IT director and is also managing the management information system. So this is inside the hospital, and this is basically the hospital in Majuro. So for this project is that there's a strong support from the government. Marshall Island really want to go to computerize their current hospital. The top management are active in giving priority for the MIS project. And then right now they are actually purchasing advanced computer hardware and peripherals. Of course, the staff and the resident doctors are very good in terms of the attitude, and they're easy to get fund easily. They're easily getting fund from the US because they have ties with the US government. Now the weakness I identified here, they have a lack of technical personnel. Actually, I visited the island I was one of the consultant before in this island. We have this project called the medical referral system. So I was there to check and inspect the location. So most people there are not very much technical, and up to now they need more training for this. So it's one of the weakness. So the opportunity, increased grants from the US. So if we are going to define this, we can define the system analysis. We can provide to the US. So currently we have here the Majuro, In the module, they have a patient registration, the outpatient encounter, and the laboratory request. Oops, sorry. But in the laboratory in these systems, they have difficulty in getting the reports, and some of them are just doing it manually. Also in the eBay, they have the same system in Majuro, but they are not linked or they're not connected. So if you are a patient in Majuro and then you're going to eBay, you will register again. So, and then of course still the same reports are not they have difficulty in getting the reports. And we have here the other clinics. The other clinics mostly are registration, but there's no report. So their current system, the informations entered in the system cannot be retrieved most of the time. Major reports generated are usually re-edited or reformatted manually. So mostly when they're going to submit these annual reports to the grantees, they do it manually, they do it in Excel. A lot of redundant data entries, yeah, because it's not integrated. So if you go to, like I said, if you go to the eBay, you have to register again. Maybe if you go to the other clinics, you have to register again. Tedious and frustrating, yeah, that's a term. So difficulty of monitoring receipts and disbursements of funds. So project identification. The name of the project is the Integrated Hospital Information System, or I call it IHIS. These are the modules: the patient registration, the patient admission, the room accommodation, pharmacy, inventory, outpatient encounter form, laboratory, radiology, and the AMR, or the electronic medical record. So basically this is the conceptual design. In the center we have here the electronic medical records, which is from the central. We have the main database, and then on the right side we have these are the clinics. Below are the database from different hospitals. Medical referrals these are the database for the patients that being referred to the other facilities outside the Marshall Island. And then this primary care, healthcare, these are some other facilities, like these are diabetes centers. I think there's another one, the 177 program, that's for the cancer patients. So this will be a separate database also. Okay, so basically the patient registration process will start with, the patient will come, and then they have this finger scanning. This is to make sure that this person is the real person. So you scan the 5 fingers. So if it's already registered, it will go to, if it's already registered, it will go to the information, and then it will allow you to select which clinic you want to go. Then of course you have to pay in the cashier. In Marshall Island, their policy is if you are a citizen, you just pay $17, I guess, $17 for each visit or checkup. And for the if you are a tourist, I think there's a different rate. That's double, like $34. So for every visit, that's their fixed charge. But of course, in the system, it's okay. So this is the conceptual design of the patient registration process. So the patient in the registration, you have to scan the finger. So if it is not, if the system then found the patient, then it will go to the manual search. If it's not found, then you have to add the patient, and you have to scan the finger, take photo, then update the data. And then if you are already registered, just the system will just display the information, and the registration personnel just select which destination, which clinic the patient wanted to go. And then of course there's a cashier, and then if there's a payment, this is optional. If there's a payment needed, then they have to go to the cashier. If not, then you just proceed to the clinic. And then this one is the admission process. Of course, the patient will come and you want to get admitted. This ER, maternity, reproductive, and outpatient departments are the entry point for the admissions. So you can get admitted if you are in the emergency, like, or maternity, if the patient is going to deliver. And then this reproductive is this similar to reproductive is for the women, special department for the women. Then the outpatient, of course, outpatient departments. So if the doctor decided to get you admitted, then this department can also process the admission. So of course, the same as scan the finger or search for the last name and first name. And then if the patient is already registered, then they'll have to go to the admission. If not, then they have to register. It's basically the process. So the user interface, this is the user interface. We have there, this is the patient registration module. So the patient registration module, it will automatically detects possible duplicate records having similar patient names and the patient being registered. This helps in preventing duplicate patient registrations. So the patient admission user interface. The patient admission module facilitates the recording of admission and discharge for inpatients and provides a census of all admitted patients with the room they occupied. Room accommodation. The room accommodation module allows the creation of room and bed grouped into different room types or departments. Okay. And then we have here the inventory. The inventory is the system's own set of inventory modules that monitors and control the receiving, transfer, and issuance of inventory or the inventory items in pharmacy and CSR departments or the clinical services request departments. It also has a various reports that shows the transaction done, which its type of item are any given period. So basically these are the screens for the inventory related modules. The outpatient encounter. So the outpatient encounter form enables the healthcare the healthcare provider record all observations, diagnosis, prescriptions, and procedures ordered during a patient visit. The system automatically arranges this information in a standard SOAP, or the subjective, objective, assessment, and plan format for a well-organized presentation. It is also as a link to laboratory and radiology modules, which allows for immediate ordering of tests. So basically, this screen is similar to the electronic medical records. So all this information will go to the electronic medical records of this patient. The laboratory module. The laboratory module provides the forms for ordering laboratory tests and recording of the results. It allows users to manage the analyte that needs to be examined for each particular test. Procedures, reference values can also be set to allow automatic detection of result values that fall outside the normal range. You can see there's some color coding here. If the result is it's a greater than or alarming result for the patient. The radiology module. The radiology module has the form for ordering test procedures and recording of their result. It permits each user to set up templates for quick reference and entering of test remarks, methodologies, findings, and interpretation. So, okay, now the implementation plan. These are the activities involved during deployment of the system modules. Target task schedule. On 1st of June, we'll start the project. We'll perform the site visit. That will take a day to check. And this is the Gantt chart. Yeah, same here, the schedule. After the timeline. Okay, these are the references. Miss Edlin Ansoris, she's the MOH IT director, and she provided me this MOH medical referral reports. And then is Mr. Umali, Marlon Umali. He's the GMI project manager, and he provided me the software specification document that's basically related to the health information system. And we have from this website, National Planning Cycles, they publish this MOH strategic plan, where the MOH mentioned their plan for the computerization of the health information system. I mean the healthcare system. And then, okay, that's the end of my presentation. Thank you, or Komol Tata, according to the Marshallese language. Have a nice day.